Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and here is what I bring to you all from the world of medicine. How attention deficit hyperactivity disorder drugs are helpful in treating Alzheimer's disease. There is good evidence that drugs to treat attention deficit hyperactivity disorder might also successfully treat key aspects of Alzheimer's disease, finds a pooled data analysis of the available research published online in the Journal of Neurology, Neurosurgery and Psychiatry. Noradrenergic disruption occurs early in Alzheimer's disease and contributes to the cognitive and neuropsychiatric symptoms that characterize the condition, suggesting that the noradrenergic system would be a good target for drug treatment. The researchers therefore looked for clinical trials published between 1980 and 2021 in which noradrenergic drugs such as atomoxetine, methylphenidate, and guanfacine has been used to potentially improve cognitive and/or neuropsychiatric symptoms in people with neurodegenerative disease. They included a total of 19 randomized controlled trials focusing on Alzheimer's disease and mild cognitive impairment involving 1,811 patients. 6 of these trials were judged to be good quality, 7 as fair, and 6 as poor. The results of 10 of these trials involving 1,300 patients were pooled for global cognition, orientation or attention, memory, verbal fluency, language, and visuospatial ability. This showed a small but significant positive effect of noradrenergic drugs on overall cognition as measured by the mini mental state exam or the Alzheimer's disease assessment scale. The results of 8 clinical trials involving 425 patients were then pooled for behavior and neuropsychiatric symptoms, agitation, and apathy. And this showed a large positive effect of noradrenergic drug on apathy even after removing outliers to account for differences in trial design and intended outcomes. Repurposing of established noradrenergic drugs is most likely to offer effective treatment in Alzheimer's disease for general cognition and apathy, the researchers ended. How gastric cancer survival is connected to marital status of people. Marital status is likely to be an important contributory factor in predicting long-term survival in people with early-stage gastric cancer, suggested a research published online in the Journal of Investigative Medicine. It should be added to the usual list of clinical and personal variables used to inform how long a person is likely to live after diagnosis, say the researchers. The prognostic value of marital status has been recognized for people with cancers of the liver and the lung. It isn't included in the list of predictive survival factors for early-stage gastric cancer. The researchers took clinical information that has been entered into the Surveillance Epidemiology and End Results database from 3,647 patients diagnosed between 2010 and 2015 with early-stage gastric cancer that hadn't spread beyond the stomach to other parts of the body. The following variables were included: age at diagnosis, race, gender, tumor site, molecular findings, that is histology, grade, that is appearance of cancerous cells, spread to the lymph nodes, which is stage, surgery, lymph node removal, chemotherapy, radiotherapy, tumor size, insurance, and marital status. Some 1793, that is 49% of the participants were men, and 1854, which is 51%, were women. Most, that is 2231, were white. In all, 1957 were married and 274 were divorced, 41 were separated and 630 were widowed, while 512 were single and marital status wasn't known for 233. Overall survival prospects were better among women than among men and among people who were married. In the training group, people who were married had the best prognosis, average 72% chance, while widows had the worst, average 60% chance. Similarly, when gender was taken into account, the chances of survival were highest for married men, that is average 69%, and married women, average 76%, while they were lowest for widowers, average 51%, and widows, average 61%. Survival was also significantly better in divorced women than it was in divorced men. The researchers concluded that all patients diagnosed with early-stage gastric cancer can use their nomogram to assess their prognostic risk after receiving corresponding treatment. Overdosing of vitamin D supplements. Overdosing on vitamin D supplements is both possible and harmful. warned the doctors in the journal BMJ Case Reports after they treated a man who needed hospital admission for his excessive vitamin D intake. The case concerns a middle-aged man who was referred to hospital by his family doctor after complaining of recurrent vomiting, nausea, abdominal pain, leg cramps, tinnitus, dry mouth, increased thirst, diarrhea, and weight loss. These symptoms had been going on for nearly 3 months and had started around 1 month after he began an intensive vitamin supplement regime on the advice of a nutritional therapist. He had been taking high doses of more than 20 over-the-counter supplements every day containing vitamin D, 50,000 mg. The daily requirement is 600 mg or 400 IU. Vitamin K2, 100 mg. Daily requirement is 100 to 300 microgram. Vitamin C, vitamin B9, folate, 1000 mg, whereas the daily requirement is 400 microgram. Vitamin B2, that is riboflavin. Vitamin B6, omega-3, 2000 mg twice daily, where the daily requirement is 200 to 500 mg, plus several other vitamin, mineral, nutrient, and probiotic supplements. The results of blood tests ordered by his family doctor revealed that he had very high levels of calcium and slightly raised levels of magnesium, and his vitamin D level was 7 times over the level required for sufficiency. The man stayed in hospital for 8 days, during the time he was given intravenous fluids to flush out his system and treated with bisphosphonate drugs that are normally used to strengthen bones or lower excessive levels of calcium in the blood. 2 months after discharge from hospital, his calcium level had returned to normal, but his vitamin D level was still abnormally high. Nevertheless, complementary therapy, including the use of dietary supplements, is popular, and people may not realize that it's possible to overdose on vitamin D or the potential consequences of doing so, the researchers said. This case report further highlights the potential toxicity of supplements that are largely considered safe until taken in unsafe amounts or in unsafe combinations, the researchers concluded. How death of a close family member increases the risk of heart failure. Heart failure patients experiencing grief or in mourning following the loss of a close family member are at an increased risk of death, particularly during the first week following the family member's death, according to a study published in JACC Heart Failure. Many studies have also been conducted to confirm the relationship between severe emotional stress and Takotsubo cardiomyopathy, also known as broken heart syndrome. This study is one of the first to investigate the association between bereavement and heart failure risk. The study authors looked at almost 5 lakh patients from the Swedish Heart Failure Registry during 2000 to 2018 and or patients with a primary diagnosis of heart failure from the Swedish Patient Registry during 1987 to 2018. Information on date and cause of family member deaths, that is children, spouse, partner, grandchildren, siblings and parents, was obtained from the cause of death register. A total of 58,949 participants experienced bereavement during the mean 3.7 years of follow-up. The association between bereavement and increased heart failure mortality risk was observed after death of a child, which was a 10% increased risk, spouse, partner, a 20% increased risk, grandchild, a 5% increased risk, or sibling, a 13% increased risk, but not after death of a parent. The risk of dying from heart failure after the loss of any family member was highest during the first week of bereavement, a 78% increased risk, particularly in the case of a death of a child, a 31% increased risk, or spouse, partner, a 113% increased risk. It was also higher in the case of 2 losses, a 35% increased risk, as opposed to 1 loss, a 28% increased risk. The association between bereavement and mortality was not only observed in cases of loss due to cardiovascular disease and other natural causes, but also in cases of unnatural deaths. These findings point that bereavement was associated with mortality in heart failure patients, which contributes to and extends the existing literature regarding role of stress in prognosis of heart failure, and is consistent with studies reporting associations between bereavement and increased risk of incident cardiovascular conditions, the researchers concluded. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.